Hi, I'm Dr. Susie Gronski, doctor of physical therapy, certified sex counselor and educator, and pelvic health specialist. And today I'm going to be reacting to it and offering some commentary around a clip from The Office where Andy has some erection difficulties.
So last night was so not a big deal.
Oh, yeah, I was just tired.
We both were.
Totally. If you're stressed, if you're tired, you're not gonna have that much energy for sexy time. It's normal for anyone.
I was definitely not my normal sexy self.
Whoa.
Hold up right there, Aaron. His non-erection is definitely not a reflection of whether or not he was aroused with you or enjoying a pleasurable moment with you. Erections can wax and wane. That's completely normal. So you don't have to be insecure about it.
Are you kidding? You were so sexy. Just the thought of you last night, like, crazy turns me on. It just didn't last night.
But really, it's not a big deal.
Right. So her insecurities are now being reflected onto Andy, and Andy's like, listen, I found you super sexy. It wasn't you, it's me bit, right? But this is very common, normal, and natural for any relationship. What your genitals are doing do not reflect your level of arousal. As he said, he was super turned on. And Andy's penis, and any penis, is not a machine. It's attached to a human body with human experiences. And if you're tired, stressed, or if there's relational conflict, your penis is just not going to operate the way you want it to.
Yeah. I know, it's not a big deal.
So how partners respond to another partner's sexual difficulty also matters. So if you are a female partner with a male person and you experience a waxing and waning of the erection, lean into your partner. Know that you support them and care for them without making a big deal about it. Lean into pleasure and intimacy with each other. Don't minimize his experience either. Please validate that he might be going through some of his own stuff related to his sexual experience and the changes with his body. So don't minimize it or just brush it off like, oh, totally okay. Really let them know that you're there for them and validate and affirm their feelings.
When you lost the manager job,
Yes.
did it affect you outside of the office?
How?
I don't know what the technical term is. Penial Softiosis.
Penial Softiosis. While that's very cute, what she's describing is erectile variability or erectile dysfunction, but actually we're not really sure that this is a pathological onset of erectile dysfunction. Really what I think we should be saying here is erectile variability.
You came to the exact right person for this. No, I have never once experienced anything remotely like that. Never. Okay?
Okay.
Of course. Now, different experiences for different people, but I can assure you that all penises, if you've got one, over time, you are going to experience erectile difficulty or waxing and waning of your erection.
Every day I brief Nellie on what's going on in the office. Most of it's irrelevant, but a good informer doesn't judge what's worth passing on. Oh, and Andy lost his masculinity, so congratulations on that.
Hold up. Lost his masculinity? Of course, many men do identify personally with their physical ability to have an erection. That is part of their identity, and certainly if that starts to change and impact their own self-confidence and or their relationships, that could take a really big toll on one's sense of self, really. So of course it's going to change how they feel about themselves when all of a sudden things start to change.
Aaron made it clear to me that he was unable to perform sexually last night. By contrast, I went to sleep with an erection so large it was like I was wearing no blanket at all. Wow, I knew you'd win, but you just demolished him.
So listen up. Sex is not a pass-fail exam. Penises are not machines. They're not separate from the person who has them. Intimacy is the most important factor when it comes to sexual satisfaction. It's not how many times you do it, how long you do it, or how hard your erection is during sex. Of course, sexual function can be part of that, or intercourse can be part of that. But it isn't really what defines satisfaction in coupleships. In fact, if you enjoy the sex that you're having, you enjoy the sex that you're having, and it doesn't necessarily have to mean rigid erections and penetrative intercourse. There's so much more to sexy time than performance.
Thanks for watching. If you want the real uncensored scoop on all things pelvic and sexual health, join me on Patreon. You know, in case YouTube thinks my content is a little too, spicy. Let's learn, laugh, and get real about your private parts together. See you next time.